the systemic racial. Oh my goodness. So, as we all know, we hear it on the news all the time. Black women are dying from giving birth. And I think last year probably was the highest that I've ever seen. And it's really sad because they don't listen to us. They really don't listen to us. I tell my mothers, you know your body best. Don't let somebody else tell you about your body. Birth trauma actually starts before delivery. It starts when the mother finds out that she's pregnant. And the thinking, is she going to be fit? Does she have a great support system around her? Is there people that are stressing her out? Are there people filling her head with unnecessary, motives? Or you have to do this and you have to do that. And mothers don't, a woman would start to second guess herself. Her stress level needs to be at a 0, because if a mother's stressed during pregnancy, that creates complications. And then that energy is also passed on to the child as well. Everybody's different. Everybody's body is different. You have to listen to your body and learn to speak up for yourself. If you feel something is off, it doesn't matter what it is. It could be little. It doesn't matter. Speak up. If something is wrong, say something. Even in the delivery room, if you don't like how you're being treated, request another doctor, request another nurse. You have that free will to do that. Don't let these doctors and nurses bully you into thinking this is what you have to do. No, this is your body. You have the say so over your body. Nobody else can tell you what to do with your body.
This is the I Choose Health podcast, where choosing health is choosing power, possibility, and purpose. Today's guest is doula and mental health counselor, Nicole Potts. Welcome back to our segment 52 Choices. The second habit that we should focus on this week is tracking your meals for 1 week to understand your habits. In a study entitled Self-Monitoring and Behavioral Weight Loss Treatment, a systematic review of studies on dietary self-monitoring, the authors Burke, Wang, and Sevick published in the Journal of the American Dietetic Association in 2011. Their objective was to examine the role of self-monitoring, such as tracking meals, in behavioral weight loss interventions. The key findings were that self-monitoring dietary intake is consistently associated with greater weight loss. The more consistently participants tracked their food intake, the more weight they lost. Using digital tools like apps increased the likelihood of sustained tracking and better outcomes. Participants who self-monitored more frequently, for example daily, had significantly better results than those who did not. In conclusion, meal tracking is a powerful and effective tool in weight loss. It increases awareness, helps manage portion sizes, and supports accountability. All right, this is I Choose Health, the show that puts you back in the driver's seat of your life. I'm your host, Stephen Leslie, and each episode is your reminder that choosing health is choosing power, purpose, and possibility. Black Maternal Health Week is recognized each year from April 11th to 17th to bring attention and action in improving Black maternal health. Everyone can play a role in working to prevent pregnancy-related deaths and improving maternal health outcomes. Why is Black maternal health important? Racial disparities exist. Black women are 3 times more likely to die from a pregnancy-related cause than white women. Multiple factors contribute to these disparities, such as variations in quality health care, underlying chronic conditions, structural racism, and implicit bias. Social determinants of health prevent many people from racial and ethnic minority groups from having fair opportunities for economic, physical, and emotional health. What role do doulas play in maternal heart health? One of the ways doulas support their clients is by supplying them with evidence-based information. Doulas are trained to understand the complications that can come with pregnancy. They provide their clients with information about the symptoms of preeclampsia, encourage them to talk with their doctors about their blood pressure, and ask questions about tests such as gestational diabetes. Our guest today serves in this role, and her work is twofold. She's also a mental health counselor, and that is such a vital role in Black communities all around America. Today, we welcome Nicole Potts to the show.
Hey, good morning. Nice to meet you. Nice to be here. I'm excited to be here.
Yes, I'm definitely excited for you to share this perspective. I'm really looking forward to our conversation. I think that there's so many insights that many people often overlook, especially when it comes to Black maternal health, the different things that affect Black mothers. So I'm really excited to look into this conversation today.
Oh my, I'm so excited.
Yeah. So Nicole, I want you to share a bit about your journey and what led you to become both a doula and a mental health counselor.
So I started off as a doula first. I am a mother. I have 3 kids, and each one of my pregnancies, I was high risk with all of them. I had difficult pregnancies, always in the hospital. But then my last pregnancy was terrible. And the treatment that I got during that pregnancy was atrocious. So I was displeased from beginning to the day that I gave birth. And within myself, I said, something has to give, something needs to be changed. And if you want change, then you have to be that change. So after I had my daughter, I looked into being a doula because I believe us as a minority, we don't have a lot of advocates. And I see it. I've been working in the medical field for over 15 years, and we don't have anybody to stand up for us. We have to stand up for ourselves. We have to do the research. We have to educate ourselves. So I became a doula so that I can speak up and advocate for us, for the people that don't have somebody behind them, that don't have that support. So that's how I became a doula. Mental health counselor, same thing. I have people around me that deal with anxiety, that deals with depression. I experienced postpartum depression with my second child. And again, didn't have a support system. I was able to pull myself out of that, the postpartum depression, but it took some time. And again, we just need a community. We just need somebody to advocate, somebody to help us, somebody to educate, and also bring awareness that this is an everyday thing that goes on within our community, and our mothers need that support. We need that help. We need somebody to be there for us. So that was my motivation to become a doula and a mental health counselor.
And, in that experience, what are some of the specific emotional and psychological challenges that you've seen that Black women face during pregnancy and postpartum?
Ooh, the list is very long. For one, our bodies change physically and chemically. Our hormones are changing. We sometimes we don't know how to deal with the emotions, or the hormones are twice as much. And then some people take it the wrong way. Oh, she's crazy, or she's this. Not realizing that we're not in our normal state. And there's some people that don't know how to deal with that. Then it comes to worrying. Am I going to be a good mother? Am I ready? Am I fit? So stuff like that. Women, we already overthink, but then when it comes to being a mother and being, going through pregnancies, we tend to worry a lot. So we do need that support system. Worrying if we have everything for the baby, worrying if our when we give birth, is it going to be a nice smooth birth? Even throughout the pregnancy, going to the doctor's office, is our health okay? Are we eating okay? It's a lot of stuff that goes on mentally when you're pregnant that a lot of people do not know that we go through.
Yeah. And, also share how partners and family can support women in this postpartum period of their life.
Support system is definitely big. I tell my mothers when I meet with them, the first time we meet, we create a birthing plan. And I always ask them on that birthing plan that you have, you need to find somebody that is going to support you physically and mentally because you're going to need it. It is a lot. You have to, well, I'm going to use myself as an example. All of my pregnancies, I got put on bed rest. I was on complete bed rest, so I couldn't do things for myself. You need somebody that's going to be in your corner that says, hey, okay, she can't get to this right now. Let me help her. Let me take this load off of her. And once there's a load taken off of you, it also physically, it also affects you mentally. And now you don't have to stress about that. Okay, after the baby is born, let me take the baby from her. Let her get her sleep because sleep is needed. Let me feed the baby. Let me do the laundry. Let me, stuff like that us mothers need, especially during the support system. When it comes to giving birth, mothers, I guess everybody thinks, oh, okay, a doctor delivers a baby. No. Doctors do not deliver babies. A mother, your body is what delivers your baby. Everybody else in that room is your support system. So a support system is definitely needed. Your body knows what to do. Look at animals, for instance. You see animals in the farm, they just sit there and they have their baby. There's no doctors around, yes, you need doctors if there's complications, but your body knows what to do when it comes to giving birth.
Yeah. And, not to get into the specifics of it, but I remember, we had our daughter close to 2 years ago. And, it was all very new for me as well when it came to things like birthing plans. And I think to an extent, when we, went into the delivery room, everything remained on point when it came to the birthing plan. And I felt like up until the last minute, I thought there was like a slight deviation from that in regards to some things that we put into our birthing plan. I imagine that a Black doula is also, or doula in general, is very important, making sure that birthing plan is kind of followed to a T. Or also, if you think that there may be a need for a deviation given the situation, that you provide that advice as well.
Yes, that is true. Of course, no pregnancy is the same. And that's why I always tell my mothers to have a birthing plan. Just make sure you have a birthing plan. We all know life happens sometimes and things don't go the way we expect them to go. But if you have that birthing plan in place, it helps when it comes to having when it comes to delivery. Also, when whoever is there in the room to support you, they know what your birthing plan is like. They know the things that you're requesting in your when you're giving birth. Do you want a home birth? Do you want a water birth? Some of my clients, they have like little Bluetooth speakers that's playing like classical music to keep them calm. Some of them have a diffuser. Some of them, want to be massaged, or a medicine ball to help them with the delivery. All of that can be included on your birthing plan. And if something arises, I would say, for me, when I had my first daughter, during delivery, her heart rate dropped. So stuff like that. Or if mothers are high risk, like I was, and have preeclampsia, it's we want to have a natural birth, or we want to have a regular birth. Sometimes it doesn't happen, and this is where your obstetricianist comes into play. You have to do your research on these doctors. make sure your doctor knows what your birthing plan is and that your doctor aligns with your birthing plan, because, or else there's going to be problems. So that plays a big part in it as well.
Yeah. And we're going to kind of change gears here. And in your experience, how does systematic racism in medical settings impact mental health outcomes for Black mothers?
Ooh. Oh, the systemic racism. Oh my goodness. So, as we all know, we hear it on the news all the time. Black women are dying from giving birth. And I think last year probably was the highest that I've ever seen, and it's really sad because they don't listen to us. They really don't listen to us. I tell my mothers, you know your body best. Don't let somebody else tell you about your body. And I think that's where most of the issues lie. They don't like to listen to us. Me, with my last pregnancy, I know that I could never carry up to 40 weeks. I already knew that. I knew I was high risk. From when I found out I was pregnant, I already knew I was going to be high risk. I told my doctor that. I told my doctor I was not going to carry up until 40 weeks. My doctor didn't want to listen to me. I was in labor probably for like 2 weeks because my doctor didn't want to listen to me. I went to the hospital. I'm having contractions. Nobody wanted to listen to me. I got sent home. And that's one of the biggest mistakes that the hospitals do. They send you home. Oh, it's nothing. It's just contractions. You can deal with it. And they send you home. I helped my cousin with her delivery. She had preeclampsia. However, she was able to give birth the natural way, but they wanted her to have an emergency C-section. It wasn't needed. It really wasn't needed. All they had to do was just break her water for her, but they didn't want to do that, and they let her endure that pain even more, and it traumatized her and caused her pressure to rise. So now they have to deliver via C-section. And that's how, it's sad to say, but that's how a lot of us women die during delivery. They die having a C-section or complications that could have been avoided had you listened to the mother beforehand.
Yeah, and I feel like I see that consistently where, either there's also the process of kind of trying to rush mothers through the delivery process, where it's like, okay, we need to get you out of here. We need to get somebody else in this room, right? And that goes into the Black maternal health aspect of it. But then also just in our day-to-day interactions with, people in the workforce or just social interactions in general with other people who are white. Unfortunately, there feels to be this consistent thing of them not listening, right? Not listening to what it is that we have to share, not in terms of our experiences, what we've been going through, and to some extent, it just becomes whitewashed. Nobody hears us. So,
absolutely correct.
Yeah. And what are common things your clients carry with them into birth, whether that's trauma, fear, generational narratives, and how do you help them work through that?
A lot of the mothers that I've helped, majority of them carry fears. It's that fear of delivering. Am I going to have what is my delivery going to look like? Am I going to have to go in for a C-section? And I'm going to be honest with you, a lot of my recent mothers, have complications. So that's another thing. The worry is already there, but if you don't have a good doctor that's going to reassure you, hey, you're going to be okay. We're here to help you. We're going to do the best, we're going to give you the best care that we can, as opposed to somebody just want to bring you in, rush you, have your baby, and send you home, or bring you in. We're going to schedule you for a C-section and send you on your way. I think that reassurance from the doctor and from the staff helps a lot of the mothers. But a lot of my mothers, they go into the delivery room with fear. I don't see so much I do see some generational practices. Of course, certain foods to eat, exercise more, but that's positive. I don't see a lot of the negative generational traditions. I don't see a lot of that. The only thing negative that I see is really the fear and the stories that they've heard, or you need to get an epidural, or you need to do this. That's pretty much the only thing that I've seen.
Mm-hmm. Now you've shared your experience with us in terms of your experiences in terms of childbirth. Can you describe a time, especially in relation to your patients, when your presence made a measurable difference in how your client was treated by healthcare staff?
Oh, yes. So with my cousin, she had preeclampsia. She went through her whole pregnancy. Her doctor did not diagnose her with preeclampsia. She lived in North Carolina, and she FaceTimed me one day. And I was like, you don't look good. You look, she was swollen. Like, this is not normal. And I told her, go to the emergency room. You do not look like what you're supposed to be looking like. And lo and behold, when she went to the emergency room, they diagnosed her with preeclampsia. This was her last trimester. I think she was probably about 37 to 38 weeks. And they sent her home. She called me again. She said she wasn't feeling well. She thought she was feeling Braxton Hicks, but they were actually contractions. I told her, monitor them. How far are they apart? If anything, if they're at least 5 minutes apart, you need to go back to the hospital. She went back to the hospital, but because her cervix was closed and she wasn't dilating, they wanted to send her home again. I said, no, I'm going to book the next flight out. Book the next flight out. By that time, they had admitted her to the ward. But I guess before I got there, the news that they were giving her and the way that they were giving it to her, it just increased her anxiety. So when I got there, I had to reassure her, like, okay, you have preeclampsia, but it's okay. I had to calm her down. Her mental state was through the roof. And by them doing that and them alarming her like that, it created trauma in her. This is her first pregnancy. So she didn't know what to do. She didn't know what to believe. She's just going off of by what the nurses is telling her, what the doctors are telling her. So that didn't help at all. So you had to reassure her, calm her down, bring her pressure down, bring her something soothing, massage her, play music for her to calm her down, in which I did. Unfortunately, her son's heart rate dropped. So they did have to rush her in for emergency C-section. But had they listened to her before when she went there and told them that something was wrong, she could have avoided that.
So I definitely like the answer that you shared, because I felt like it kind of goes right into the next question. And that is, what is something people might not realize about how birth trauma happens, and how long can it last?
So birth trauma actually starts before delivery. It starts when the mother finds out that she's pregnant. And the thinking, is she going to be fit? Does she have a great support system around her? Is there people that are stressing her out? Are there people filling her head with unnecessary, motives, or you have to do this and you have to do that? And mothers don't, a woman would start to second guess herself. Her stress level needs to be at a 0, because if a mother's stressed during pregnancy, that creates complications. And then that energy is also passed on to the child as well. After pregnancy, PTSD. There's some women that have PTSD when it comes to birthing, or when it comes to pregnancy. She's always going to remember how she was treated during her pregnancy. She's always going to remember what went on in that birthing room. And then after giving birth, the body takes a while. For some of us, it's years for us to go back to our pre-pregnancy state. She has to worry about baby blues or postpartum depression. And postpartum depression is affecting our women drastically because we don't have that support system. We don't have that aftercare. The doctors want to discharge you, and that's it. Nobody checks up on mom after she leaves the hospital, after she gives birth. Nobody checks up on her. So that's where that support system comes into play as well.
Yeah. And what would you say are some protective or healing practices you encourage for Black mothers?
For me, if you need help, don't be afraid to ask for help. Everyone needs help, especially if you are a new mother or if you just had a baby. You are going to need help. There's some people that are around you that just don't know. Just ask for it. Hey, can you help me? Can you watch the baby? I'm tired. I need some sleep. A lot of moms don't get the sleep that they need because they have to wake up every 2 hours to feed the baby. So they are sleep deprived. Another thing, go outside. Go take a walk. Take the baby for a walk. Fresh air is good for healing, especially mentally. Take certain herbs are good for healing as well. There's tea. There's red berry ras tea, echinacea tea, nettle tea. There's a lot of herbal teas that they can take as well. Journal is my favorite one. When the feelings are coming over you and you just don't know, or you don't have anywhere to express, journal. So those are some of the things that I do tell my mother to partake in.
And, we know that the maternal mortality rate for Black women is much higher than that for white women. How do these stats affect the mental health of your clients before they even step into a hospital?
A lot of them, I see a lot of my mothers, they don't even want to step into a hospital. A lot of them are going through either home birth, or they go to a birthing center because they want a water birth. They want to deliver more naturally. Because a lot of them are really terrified of stepping foot in the hospital.
Yeah. And I think that is so pivotal to understand. And I do see how the role of a doula is really helpful in a situation like that. And what conversations do you think should be happening between doulas, therapists, and medical professionals to create more holistic care?
Everybody has to be on the same accord. And the only way to do that is to listen to the mother. You have to know the mother's history, what her health history is like. Things happen during pregnancy, just like preeclampsia, gestational diabetes. Educate mom on what's going on with her. A lot of women, they get gestational diabetes and they get preeclampsia, and they've never heard of these things, so they're not educated on it. Educate mom, and then everybody has to come together with a perfect plan. Not just a plan to get mom in the delivery room, deliver the baby so doctors can get paid and then send them along their way. No, mom is the most important thing in that hospital, in that birthing room. So mom, the doula, the support system, the doctors, and the nurses, everybody has to be on one accord. Listen to mom. If she's saying something is hurting her, listen to mom. Dissect what it is. Don't just assume you're hurting. Oh, it's Braxton Hicks, when it could have been something else. Don't dismiss her, because then that also affects her mental health. If she's in pain and you're dismissing her, that's going to add on to her trauma.
Yeah. And, and this kind of leads into the next question as well. Do you think that hospitals and providers are adequately trained in cultural competency and trauma-informed care? And if not, what's missing?
I'm going to say all of them. There are some doctors that actually do care about their patients. They're doctors that are in it because they love what they do. And then there's others that at the end of the day, they just want a paycheck. And this is where I tell my moms, you have to research your doctors. Know who your doctors are. Question your doctors to see if they know what's going on. What I feel is missing: care, compassion. Nobody has, let me not say nobody, but a lot of these providers and physicians, they don't. Everybody just wants a paycheck at the end of the day. And that can't be when you're dealing with somebody's life. You have to have compassion. You're not dealing with just one person's life. You're dealing with two people's life, or three, depending on how many babies she's carrying. So somebody else's life is in your hand. You have to handle it with care. You have to handle it with compassion. And that is really missing in the medical world this day.
Yeah. And what would you say what does reclaiming joy in the birthing process look like for you and for your clients?
For me, I'm more of a natural person. I'm a naturalista. I know not everyone can go the natural route, but if everybody would educate themselves on holistic remedies and holistic care, we wouldn't, the maternal, that rate would come down drastically. If we stop depending on medication, if we stop depending on these doctors to cure us, and we can deliver our own babies, we can heal our own selves, that just seeing that vision would bring me so much joy. Having that support, having that village. They say it takes a village to raise a child, and it starts from pregnancy. If everybody comes together and support mom during and after, that is such a joy to see.
And I would imagine that your knowledge or your wealth of knowledge goes beyond just what you've learned in, both the mental health field and the dual world or the medical world. But how do you incorporate like ancestral wisdom or cultural traditions in your care?
For me, I tell my moms up front, you come to me as a doula, I practice the holistic way. I educate my mothers. A lot of mothers, some of them hear holistic and they get afraid because they want the epidural. They don't want to be in pain. They don't want to. So I educate them. A lot of people are afraid of things because they're not educated. Once you educate them, their thought process or their perspectives change. So that's really what I do. I'm all about being positive. I'm all about being calm. Nobody realizes how much of a difference delivery and pregnancy is or can be once a mom's mental is when she's calm, there's no stress and she's happy, and like stuff like that makes a big difference when it comes to delivery.
And are there any stories that stick with you or moments where you witnessed a major emotional breakthrough for any of your patients?
A breakthrough for me, with one of my moms. She actually had preeclampsia, and families, with their stories, or friends with their stories, discouraging her, and she just wanted to have a C-section because she didn't want to go through the pain. She didn't want to, push or whatever. I had to educate her. When you go for a C-section, your recovery time is twice as much as having a regular delivery. Just because you have preeclampsia doesn't mean that you cannot deliver your baby naturally. And a lot of the doctors do not tell the mothers that. They hear C-section, okay, let's sign up mom for C-section because we're going to get paid more if she has a C-section as opposed to her having a natural delivery. So I pretty much coached that mother. I had to educate her. I educated her on things to eat, certain foods, change her diet, the herbs that she can take that would help her in her delivery. Mom was in delivery for about 5 hours, 3 push, and her baby was out. And she wanted her initial thought was, I want to go in there and have a C-section.
Wow. Well, what was her reaction, following delivery?
She was amazed. Yeah. I mean, she was crying. I'm gonna hope it was tears of joy because she didn't think that she could do it. She really didn't think that she could do it. She was always worrying. She was anxiety, and I calm down. You have to reassure. You have to reassure moms that it is going to be okay. You have to coach them. You have to give them that push. Be supportive of them. Once they have that support system and they know somebody's behind them, total change.
And I want to switch gears for a second because I know we've spoken about the Black birthing experience, the Black experience of mothers within the medical system. And I want to touch a little bit on your work as a mental health counselor on a whole, especially within the Black community. What have you found to be some of the, I guess, major topics that come up or major issues that you typically find yourself having to help or talk your patients through?
Delivery. Everybody's scared of delivery. Everybody's also scared of postpartum depression. Those two always go hand in hand. I tell everybody, stop listening to other people's stories. Everybody's different. Everybody's body is different. You have to listen to your body and learn to speak up for yourself. If you feel something is off, it doesn't matter what it is. It could be little. It doesn't matter. Speak up. If something is wrong, say something. Even in the delivery room, if you don't like how you're being treated, request another doctor, request another nurse. You have that free will to do that. Don't let these doctors and nurses bully you into thinking this is what you have to do. No, this is your body. You have the say so over your body. Nobody else can tell you what to do with your body. So I have to reassure them about that when it comes to delivery. When it comes to postpartum, support. Support is a major key when it comes to postpartum depression. Postpartum depression is really something that nobody can control. You just have to know how to navigate it and how to treat it. And if it goes untreated, it gets worse. And that's one of the things why I became a mental counselor, because postpartum depression, there's not enough awareness, or it's not talked about enough. I tell my mom, hey, Make a schedule for yourself. You know, okay, certain hours, you have to feed the baby. When the baby is asleep, get some sleep while that baby is asleep. And a lot of them, well, I have to do this and I have to do that. That's where your support system comes into play. Ask your spouse, ask a family member, hey, I need to get some sleep. I'm tired. Can you do this for me? Or can you take the baby so I can get this done? Then there's some times where they're going to, their body doesn't snap back. It's okay. It's going to take time. Stop rushing your recovery. It takes time. So reassuring them that there's nothing wrong with you. You're a mother. This is part of life. Just educating them and reassuring them plays a great deal.
And does your work as a mental health counselor, does it ever go outside the scope of working with mothers, or is it predominantly just with mothers?
It's outside. It's just me. That's who
Okay.
I am. I help everybody. You don't have to be a mother. Not everybody there's other people that go through anxiety. There's other people that go through depression. They're not mothers. I help them as well. There's people that are not pregnant. They've been mothers for years, raise their children and still go through certain mental illness or is having a hard time. And I'm there to support them as well.
Right. And can you touch on, because one thing I've noticed as well, and I've noticed this in myself, is that within the Black community, there is a lot of, I would call it like imposter syndrome. And there's also, I would say it's predominantly imposter syndrome, where there's a feeling of inadequacy, right? Where it feels like I'm not enough, I can't do this. This is not something that we do, right? There's certain types of phrases that we use as Black people as a way to kind of take ourselves out of the conversations or take ourselves away from what we deserve or what our value is. So kind of touch on that lightly, where you see that sometimes even like self-hate, where that comes up as well, and how you talk your patients through that.
Society plays a big role in that. Society has its standards of a mother's her body's supposed to snap back, or you're supposed to feed your baby breakfast, lunch, dinner. They're supposed to have snacks. They're supposed to have this. They're supposed to wear this. You're supposed to hold your baby a certain way. And I tell all of my mothers, if that person who is giving you unsolicited advice is not in your home, they're not helping you change Pampers, they're not putting food on your table, they're not helping you do anything, they weren't there with you during your delivery or during your pregnancy, what they say does not matter. It doesn't matter. I try to get my moms to indulge more in self-love and self-care. Baby sleeping, grab some nail polish. Polish your nails. Wash your hair. Do your hair up. If you put on some makeup so you can make yourself like you feel pretty, or something to make yourself feel good. Get some flowers. Something like that. To a lot of that self-love plays a big role in with mothers and postpartum in that syndrome. Women, we tend to be hard on ourselves because we listen to a lot of that outside noise and we just take it in, and then now we don't feel good enough because society said that we have to do this. Society have to do. As long as you are not physically harming your baby, you're not mentally, your child is not in any danger. I tell my moms, you're doing a good job. You last through the day. You made it through the day. Your baby has 10 hands and 10 fingers and 10 toes. you're doing a good job. Stop being so hard on yourself, especially if you're a first-time mom. There is no playbook to motherhood. Everybody is learning as we go along. So you can't be hard on yourself.
Yeah. Well, we're coming down to the end. We have to start wrapping up soon. But, I definitely really appreciate you, Nicole, for just taking this time to share your perspective and share your work with us. We are thankful for you. I'm thankful for you. To have someone, especially working with Black mothers in America, it's something that is so vital. Especially, I always think about Michael Jackson's "They Don't Really Care About Us" song, which I think it was so vital and so ahead of its time, because it shows us to the extent to which if they're not caring for us, then we have to care for us. And I'm really thankful that you are doing that work. You and many others are doing that work to really support our mothers, and then just help them with their mental health overall. And at this point in the show, we definitely want to we like to give our guests the opportunity to share what they have coming up next, whether that's events, and then also to share, their social media and where we can follow you to see what else you have coming up.
So I don't quite have any events right now coming up. That's actually based around motherhood. Let me not say that. I actually in Fort Lauderdale, Florida, my family, we have a nonprofit organization, and we do have a Mother's Day tea party. So if you are in Fort Lauderdale, Florida, our Mother's Day tea party is May 10th. And then I'm in the middle of planning an event. I will be in New York in June. So I'm looking to do something for mothers. I'm a seamstress, and a lot of people are asking me to teach them how to sew. So I'm trying to incorporate both, like a mommy and me class or something of the sort, because for me, sewing is a way that I de-stress. So I wanted to share that with others as well. So that's something that I am working on in June. And then my social media handles, you can find me on Facebook. My name is Nicole A. Potts. I am on Instagram, NYOKI_NIKKI.
Got it. Well, Nicole, thank you so much again. And thank you to everyone for listening. Again, this is the I Choose Health podcast. And this is where we remind you every episode that power, purpose, and possibility is there. It's totally your choice, right? Choosing health is putting that first, put in power, purpose, and possibility. Again, I'm your host, Stephen Leslie. This is the I Choose Health podcast. Looking forward to seeing you on the next show.